Hello and welcome to this special presentation, Racial Equity During and After the COVID-19 Pandemic, hosted by the National Low-Income Housing Coalition. My name's Dave Gardy. We're glad that you're able to join us for this live conversation with NLIHC's President and CEO, Diane Yentel, and best-selling author, Dr. Ibram X. Kendi. We encourage you to submit questions for Dr. Kendi during this broadcast by clicking here on the left side of the screen. And if you have to start to have technical difficulties or have a question for our support team during this broadcast, click here on that right side of the screen button. The event will be recorded and available on the site within 24 hours. It is now my pleasure to turn it over to Diane Yentel. Diane?
Great, thanks, Dave, and welcome everyone to today's conversation with Dr. Ibram Kendi on racial equity during and after the COVID-19 pandemic. So I'm really looking forward to this conversation, and I'm so glad that almost 5,000 people have registered for it today. I'm so heartened and encouraged by the level of interest in this topic. So I'm Diane Yentel. I'm President and CEO of the National Low-Income Housing Coalition. We are a membership organization that is dedicated to achieving socially just public policies that ensure that the lowest income people have decent, accessible, and affordable homes. And as part of that work, we have worked on disasters, housing response, recovery, rebuilding for many years through our Disaster Housing Recovery Coalition. And we've done this work recognizing that decades of structural racism and other structural inequities puts our country's lowest income and most historically marginalized people, people of color, people with disabilities, people experiencing homelessness, LGBTQ people, people re-entering their communities from jails and prisons, and others, at most risk of being harmed by disasters. And without our dedicated and intentional focus and effort, we know they'll be left behind in the housing recovery and rebuilding. So COVID-19, in our view, is the latest disaster to hit our country, with the same patterns of harm and neglect caused by decades of structural racism in our country. And this disaster is different in some ways, right? It's unprecedented in scale and magnitude and duration. But our urgent need to center racial equity and equity for all historically marginalized people in the response and the recovery is as critical as ever. The coronavirus clearly is disproportionately harming people of color, and it's illustrating in even starker relief the historical and systemic racism and discrimination that puts them at risk. And I believe that we have an obligation in our housing and our homelessness work on COVID-19 to center racial equity. And at this moment, when we are working together to get Congress to fund over $100 billion in rental assistance and other critical housing and homelessness dollars, Dr. Kendi's work and guidance is so important. He urges us in really profound and practical ways to develop policies and programs that are explicitly anti-racist. And he offers us guidance on how to do it. So, you know, this moment that we're in right now is unique in so many ways, most very terrible ways. But just as we're seeing COVID-19, in COVID-19 may be one of the clearest and the most obvious manifestations of structural racism in who is harmed and who's impacted by COVID-19. We also have this tremendous possibility with hundreds of billions of dollars flowing to states and cities in response to undo some of that harm, to reverse inequities, to center racial equity and racial justice in the response. So I'm just thrilled to have Dr. Ibram Kendi join me today for this conversation. Dr. Kendi is one of America's foremost historians and leading anti-racist voices. He is a New York Times bestselling author and the founding director of the Anti-Racist Research and Policy Center at American University in Washington, D.C. A professor of history and international relations, Dr. Kendi is the author of Stamped from the Beginning, The Definitive History of Racist Ideas in America, which won the National Book Award for Nonfiction. And his most recent book, How to Be an Anti-Racist, re-energizes and reshapes the conversation about racial justice in America. So Dr. Kendi, I'm a big fan of your work. Thank you so much for joining me today.
course, yeah, I'm glad we were able to have this conversation.
At long last, yeah. So we have a lot to discuss in an hour, and there's just so much of your wisdom and your work that I really want to glean for our collective housing and homelessness work. But I want to start with some of the really foundational components of your work that can guide the rest of our conversation about racial equity in housing during and after COVID-19. So most, if not all, of your published work really centers around racism being a core tenet, right, of the American way, and foundational to our country, and around the need for us to overcome the pervasive racism through the work of anti-racism. So I'd love to start there if we can, and have you, you say that it's not enough to not be racist, we have to be actively anti-racist. So can you define the different terms and talk about what you mean by that, please?
Sure. So I define a racist as someone who is expressing a racist idea, and racist ideas typically suggest that a particular racial group is better or worse, superior or inferior than another, or this is what's wrong or right about this racial group. And so I define a racist as someone who is expressing a racist idea or supporting a racist policy with their action or even inaction. And throughout the course of American history, almost every person who I would classify as being racist denied that they were being racist, denied that their ideas were racist, denied that their policies were racist. And so the term not racist, I am not racist, has really always been the sound of that denial. And I've never really been able to figure out what being a not racist truly is, other than someone denying their own racist ideas, denying the policies that they're supporting. But I do have a clear sense of what being an anti-racist is. And so if a racist is expressing an idea of racial hierarchy, then an anti-racist is one who is expressing anti-racist ideas that there's nothing wrong or right, superior or inferior with any of the racial groups. If a racist is supporting a racist policy that is leading to inequity and injustice, then an anti-racist is someone who is supporting a policy, an anti-racist policy that's leading to equity and justice. So there's really no in-between, Diane, as you know, hierarchy and equality. Just in between notions of racial policies that lead to equity and inequity. And so, again, I don't really know what it means to be not racist, but I have a very clear sense of what it means to be racist and anti-racist. And so I'm encouraging Americans to be anti-racist, because if they're not, then chances are they're being racist.
Yeah, and part of this this definition or this idea is that being racist is it's not a fixed identity, right? It's not. It can be a temporary state of being, and that all of us that are working towards being anti-racist have ebbs and flows, right? Certainly including me and including you. And you wrote about, in your book, you wrote about your own process of going from being racist to working towards being actively and consistently anti-racist. So can you talk a little bit about your process and how that applies to others?
I think the process for me was largely coming to terms with definitions. So having a very clear sense of what it means to be racist or even anti-racist. Can you imagine if you do not have a very clear definition of a racist, it's easy to deny that racist, because we don't even know what that even truly is. And so I think first and foremost, it was coming to terms with basic definitions. But then I think one of the problems with classifying someone as racist is, as you mentioned, we're actually taught that a racist is a fixed category. It's literally who a person is, not what a person is. That that it literally is in their DNA, it's in their heart, it's in their bones, that someone becomes a racist, and thereby a racist is an evil, bad person. And there's really no remedy for those racists. They can't be cured. And so with that type of perspective, I can understand why so many Americans are like, no, I'm not racist. I'm not that bad person, but that's actually not how we should understand racist or even anti-racist. And these are descriptive terms. They describe what a person is doing in any given moment. And the reason why this is critical is, to give an example, you had white abolitionists who, when they would emphasize, people like William Lloyd Garrison would say things like, and call for immediate emancipation, that slavery is horrible, it should not live another day. In those moments, they were being anti-racist. But William Lloyd Garrison and other white abolitionists sometimes in the very next moment would say, and the reason it should end is because it's so evil. And it's so evil that it literally made Black people into brutes. They're so human. And so we need to not only free them, but civilize them. That very next moment, they were being racist. They were essentially like slaveholders, imagining these enslaved Black people as subhuman.
Mm-hmm. And so in talking about how racist isn't an insult per se, right? It's a changeable state of being. And it's just a fact. It's not necessarily a judgment.
Yeah.
I think it's really important because that definition really then compels all of us to name and call out racism when we see it. And I think that a lot of people, and maybe especially white people, feel uncomfortable calling things racist. We'd rather say, racial disparities or racial inequities in the outcomes, and that's true. But it's not the full truth, right? And in being unwilling to call something that is racist, we can actually do more harm than good. Can you talk about why that is? Why it's so, where it can lead to when we talk only about racial outcomes and not about the racist systems that created those outcomes?
I mean, I think with anything, when we're talking about human beings, when we're talking about problems, it is absolutely critical to name the problem for what it is. And that, even if it's a personality characteristic of one of us, or the personality characteristic of America, right, or an institution, the first step in it receiving treatment, in it being remedied, in it changing, is identifying the true problem. And I think it's the same thing with racism. It's hard, particularly if we're self-identifying our own ideas as racist, or we're self-identifying our country or our institution or our sector of society as racist. It's hard, which is why so many people and so many institutions in so many societies refuse to grow and refuse to change, because the first step in that growth is recognizing the problem. And so I just don't know how we as a nation can transform ourselves if we don't truly recognize the true source of this pain. And that true source is racism. It's almost like the R word people are using it. Like, it's not the R word. It's not a pejorative term. It's not the equivalent of saying, I don't like you. Indeed, someone by the name of Richard Spencer once said that he lectured to white people that racist is a pejorative term. It's the equivalent of saying, I don't like you. And he just so happened is a white supremacist. And white supremacists have been spreading those ideas, particularly towards white people, so that they will continue to deny their own racism, so that those white nationalist organizers can recruit them based on their racism.
Mm-hmm. Mm-hmm. And also in not naming racism as racism and talking only about outcomes, it can lead it gives room for people to blame personal failings, right, on the outcomes, and rather than the structural inequities and the racism that created those outcomes. And I think in housing, when we talk about this, an example of, we know that people of color are disproportionately low income and are disproportionately rent burdened. And we know that Black and Native people are disproportionately homeless. And then some see those outcomes and say, well, it's a result of personal failings. And actually, Ben Carson, the Secretary of HUD, today talks about how poverty is a state of mind, and that kids should read more, like he did. And so he sees poverty as a personal failing, and so then his proposals are about fixing character flaws in individual people, when that so clearly and probably purposefully misses that it's structural racism, right, that causes these disproportionate outcomes. So aside from Ben Carson, I think that there is now a broad understanding by many of us in the housing field that many past housing policies were racist, continue. Redlining, blockbusting, subprime loans, right? A lot of other housing policies fall more into the race neutral or race blind, colorblind category. And ultimately, they also do equally, or if not more, harm to people of color. So can you talk a little bit about, give some examples of how race neutral policies can actually harm people of color, perpetuate racial disparities?
Sure. So in the 1960s and certainly by the 1970s, that is when a lot of affirmative action policies were put in place. And the racist reaction to affirmative action policies that were actually leading to reductions in racial inequity from state contracts to admissions in highly selective colleges and universities, their reaction to it was to create this framing of a race-neutral policy versus a race-conscious policy. They created this idea that a policy that has no racial language in it is race-neutral and not racist, and a policy like an affirmative action policy that has racial language in it is reverse racist or racist. But in fact, when you look at the history of American racism, the vast majority of policies that Americans collectively consider now to be racist did not have any racial language in them. So what we're talking, I mean, you mentioned, of course, some housing policies. We can go to voting policies, from literacy tests to grandfather clauses to poll taxes, did not have any racial language in them. Even the US Constitution itself, which essentially made it such that enslaved people were 3/5 of there was no racial language, right? And so just because a policy does not have any racial language in it does not mean it is anti-racist, right? And so again, if we're thinking about policies as either racist or anti-racist, then the frame of a race neutral or a race conscious policy falls to the wayside. And we can replace that framing with, if a policy is leading to racial inequities, then it's racist. If a policy is leading to racial equity, it's anti-racist. The reason why, for many people who are supporting racist policies, the reason why they want us to conceive of this idea of a race-neutral policy is because they do not want racist and anti-racist policies defined based on their outcome. Because because if we define all policies as racist or anti-racist based on their outcome, then they will have the burden of proof, proving that their policy somehow is, quote, not racist, as opposed to us, like as we do now. And as far as I'm concerned, we need anti-racist policies that are leading to equity and justice. And let me just say very quickly also, when you have a racial inequity, there's only two causes. either it's the result of policy that is favoring and disfavoring particular racial groups, or it's because there's something wrong or even right with a particular racial group. And if you're a policymaker like Ben Carson, you're not instituting policies that are leading to inequity, I should say equity or justice, or you don't want to be blamed for the persisting inequities under your administration, then you're going to articulate the only other option, which is the problem is the people, not my policies.
Yeah. So how do we create anti-racist housing and homelessness policies from the start? Where do we start, and how do we create these policies that can correct disparities and achieve racial equity?
So I would suggest, first and foremost, figuring out the true source of the problem, meaning what are the racial inequities? And so collecting that, not only the sort of quantitative data, but even the qualitative data, speaking to the people, to really seek to, understand the source, of their housing harms. And so once you have a clear and consistent and sophisticated and complex understanding, of the problem, then from there, from the evidence, from the research, from the data, from the stories of low-income people, you can then build policies based on that research, or I should say create policies based on that research that have the capacity to alleviate the harm that has been more or less expressed through that research. And then they become test cases. In other words, we should test policies. Okay, are these policies reducing racial inequities? And then if they don't, then we shouldn't also blame the people. We should go back to the drawing board and innovate new anti-racist policies and keep testing policies in different places based on different circumstances until we have a sense of what policies work, or we use policies that are actually working in certain cities in others.
Mm-hmm. So there's so much that we can apply that to now, especially with COVID-19 and with new resources going to communities to recover. So certainly we're seeing a tremendous amount of racial disparity in COVID-19 and who gets sick, who dies, who loses their jobs, who's harmed. So you've created, I think very recently, a COVID racial data tracker. Can you talk a little bit about the project and what you hope to achieve with it, what you're finding so far?
Yeah, so we started calling for states to release racial demographic data on COVID patients, in early April. At the time, only a handful of states had released breakdowns of who was being infected by race and who was being killed. By the second week of April, more and more states started releasing this demographic data, and there was no place, particularly the federal government, was not collecting and presenting this data. So my colleagues at the Anti-Racist Research and Policy Center, we partnered with the COVID Tracking Project to begin collecting that data and ultimately with the efforts to present the data. And we actually, our site went live this morning, covidtracking.com/race. But not only did we want to sort of collect and present all of the racial demographic data, and we've been able to compile the most comprehensive data set available, we also had to build a network of people in different states who are calling for this data and who are continuing to call for this data, because some states have only released infections and others have not released deaths. We're finding that in state after state, particularly in the Midwest and certainly in the Southeast, Black people are disproportionately dying of COVID-19. We're finding in states like New Mexico and Montana that Native people are disproportionately infected or dying of of COVID-19. We're finding Asian Americans in states like Alaska are disproportionately infected. We're finding that Native Hawaiians and other Pacific Islanders are disproportionately infected in Hawaii. We're finding that Latinx Americans are in many states disproportionately infected with COVID-19. And so we're finding in state after state, people of color are bearing the disproportionate burden of infection and death rates.
Yeah, so first, I'm sorry, I think I said, wow, just as you were right over you as you were saying the website. So can you repeat the website again?
Sure, covidtracking.com/race.
Great, okay. So, and thank you for doing that. What incredibly important work. And so the disease itself is obviously not racist, but the outcomes so clearly are doing disproportionate harm to Black, Latino, Native people. And the harm is made possible, right, by decades of racist policies. It's like this moment is like a crystallization of the harm that structural racism can do. So can you talk a little bit more about that and talk about how have racist policies led to Black and brown people disproportionately dying from COVID-19?
Sure. So, and I think it's critical to also talk about when Americans, particularly by the second week of April, began to learn about these racial disparities. The first argument to explain it was that people of color were not taking the virus as seriously, or were not social distancing as much as let's say, white people. Then when predominantly white sort of crowd started protesting to open the states back up, that argument, of course, hardly held any weight. And so then it began to switch to, well, Black people are dying at higher rates because they have more pre-existing conditions. And then it was never explained why Black people, typically it's not explained why, or if it is explained, Black people are apparently, it's because we don't take care of our health as well as, let's say, white people, or we're not making as many fine health choices, or and so ultimately, for many Americans, they're laying the blame for people of color dying or even being infected at higher rates on those very people of color. But the studies show otherwise. And actually, a recent study came out that found employment, access to health insurance, access to high quality medical care, poor air and water quality were actually more predictive of people of color dying of infection and death from COVID-19 than pre-existing conditions. And so if we break those down, first, employment. I mean, employment, when we think about the history of racist policies, you're talking about the history of policies that have historically led to people of color not essentially being as likely to be employed. Before this latest recession, even though the president was touting the lowest Black unemployment record in history, Black people were still twice as likely to be unemployed as white people. Black people and white people with the same qualifications who have, and when a Black person has a different sounding name, they're less likely to receive callbacks. And, you know, we can go with all of the sort of studies that show how and why Black people are disproportionately unemployed, but it's certainly not the result of their inferior behavioral traits. Access to health insurance. You know, when studies, if the refusal, particularly of southern states, to expand Medicare has had a disproportionately negative effect on people of color who are disproportionately poor in those southern states. That decision was a racist decision. And even Black people and Latinx people are more likely to not have health insurance in this country than white people. So those who advocate against ensuring that every single person in this country has health insurance are essentially advocating a racist position. And, we can go on and on about how Black and Native and Latinx communities are more likely to be polluted, which also is a major predictor, but that's not the result of those people.
Mm-hmm, mm-hmm. And so each of these racist policies have a compounding effect, right? The racist policies the racist housing policies that created segregated communities led to racist housing policies that meant we disinvested in those communities, which led to increased poverty in these communities, which leads to these increased underlying health conditions and so on, and less access to healthcare. And here we are today. So I think when we start to think about the layering of racist policies and the compounding effect it has, it feels daunting to think about how we undo and unwind that. So what intentional changes can and should we be making now to address these racist legacies?
Well, I think it can be daunting, and it certainly is daunting. But I also think it's important for us to be clear-eyed and for us to really, particularly in the housing sort of field or in any other field or sector of society, if we understand racism as the structure, it's critically important for us to constantly be thinking about the way in which all of the different elements that make up that structure, all of the policies or lack thereof that are leading to Black people and being disproportionately homeless in this society. And so if we focus on the policies we focus on the inequities and then the policies that are causing them, and then we focus on the policymakers who are either supporting us, seeking to transform those policies, or who are resisting that and even instilling and supporting racist policies, I think we can very clearly see what the problem is and who the problem is, and essentially put our focus on that what and on that who. And I think every one of us has a job to do in this sort of larger project or this larger anti-racist struggle. And so we don't every single one of us have to be simultaneously at the same time fighting against every single racist policy, but we can fight against those in our community. We can fight against those within our area of expertise. And I think that's what we should each focus on.
Yeah, absolutely. And on that, right, the Congress has already passed, well, several $1 trillion, but hundreds of billions that are going to local communities, where communities are now figuring out who to prioritize, how to use those dollars, what programs and policies to implement with those funds. And at the same time, we're pushing Congress to provide hundreds of billions more for housing and homelessness needs. So a lot of people who are on this call today are people who are advocating directly with or influencing federal policies, or they're people who are at the state and local level who with those dollars are working on creating new programs. Mm-hmm. So what would you advise us? Like, what are the concrete actions that we can take to ensure that these hundreds of billions of dollars are reaching the people who need it the most, and are being used to correct structural racism, to achieve racial equity?
Sure. So I think first and foremost, I have to figure out a way to speak broadly enough that each person, depending on what they're advocating for, can glean something. But I think it's critically important for each of us to distinguish between a program that can help an individual or uplift an individual, and a program or even a policy change that can uplift a community. And let me give an example. You had some states that are funding informational commercials to try to get people of color to become more aware or to understand the seriousness of the threat of COVID-19 to their health. That, at the most, is going to only help those individuals who are hearing those commercials who don't even know that it's a problem, even though studies show that people of color, as early as mid-March, were taking this virus more seriously than white people. And so anytime we're thinking about education or even behavioral change, that's really at the most only going to help individuals. It's not going to help communities. So when we think about helping communities, we really need to be thinking about policy change. And when I say policy change, I'm not just saying, city council sort of passing a policy that helps the community. I'm also talking about it can be within an institution. It can be within a neighborhood. It can be informal. And we need to be constantly thinking about, will this money or will this program, will this policy reduce inequity? Will it empower people who have historically been disempowered? Are those people part of the planning sort of process? Am I assuming that there's nothing wrong with the people and there's everything wrong with their conditions? And I'm striving through this work, through this funding, through this program or policy to help the people by helping or transforming their condition. If we're thinking from that standpoint, then we're thinking from an anti-racist standpoint.
Mm-hmm. Mm-hmm. I'm taking notes as you're writing, Dr. Kendi. It's just really good stuff. So I want to talk a little bit more about the purpose of racist policies. I do think that many people who are on this call today understand our country's history of racism and racist policies, from slavery to Jim Crow to intentionally segregating the country with racist housing policies. But I think if you ask most people which came first, the racist beliefs or the racist policies, I think many would say that the policies follow the beliefs. But you say, and you show really convincingly, the opposite, which I just find to be a really powerful insight. So can you talk a little bit more about how and why racist policies are advanced? Who benefits?
Sure. So, let's take the policy of blockbusting that I'm sure everyone understands. And I think it's first and foremost important for us to understand who benefited from blockbusting. And so those of you who may not be familiar with blockbusting, it was in the mid 20th century when you had particularly a block or even a neighborhood that was historically white, a family, a Black family, or even a Latinx family moved in to the neighborhood. And then typically developers or real estate agents or others would tell the other white families on that block, oh, that Black family is the first in this sort of avalanche or this invasion of Black people, and they're going to bring your housing values down, and they're going to bring crime to the neighborhood, and their kids are going to have to go to school with your kids. And so then these white homeowners would be scared into selling. So the block was thereby busted. So who benefited from that? So real estate agents and speculators, those real estate agents were able to essentially do two things. First, they were able to gain from the transaction of the white family who left. They were able to gain from the transaction of the Black family who then were brought to those busted urban neighborhoods. The developers in the suburbs who typically ushered those fleeing white families benefited. And typically those white families sold their homes below market value because they were so scared. And then they fled, of course, to the suburbs. And then typically those Black homeowners had to buy those homes above market value. And so what was happening, particularly for those white homeowners who were fleeing Black people, is they were being told racist ideas. And so then the question becomes, who benefited from that? And then why were they telling them those racist ideas? Why were those developers, those real estate agents, those speculators telling those white families those racist ideas? Why were states and cities allowing this to happen through racist policies? Because they were, so what I'm arguing is that there was a very clear sense of white people's racist ideas. And you know what? We can manipulate these white people through racist ideas to flee, sell their property under market value, buy this new property that they don't necessarily need in the suburbs, and we're going to benefit from it. So what I'm ultimately arguing is this is no different than you have currently the Republican Party recognize that they would benefit if Black and Latinx voters were disenfranchised. And so then they instituted policies like voter ID laws, like, banning early voting, that then targeted African-American voters with surgical precision, to quote a North Carolina court. But then they needed a justification. They needed to explain, particularly to their voters, to their white voters, why they were doing this. And then they created this idea of voter fraud, this long-standing racist idea that people of color are fraudulent voters. And then white people typically consume those ideas. And then they supported these policies that were benefiting these politicians who knew that the only way they can maintain office or even win an election was through voter suppression. So ultimately, it's just like slavery. People were enslaving people to make money. First and foremost, they were supporting racist policies that allowed them to enslave people so they can make more money. And then they articulated, expressed, produced racist ideas to justify what was making them money, to substantiate those racist ideas. And then Americans started believing those ideas. And then that's how people became ignorant and hateful. And so that's what I show in my work, that really the racist policies and the self-interest behind those racist policies, and if there's ever a sector that can understand it, it's the housing sector. And the racist policies then led to the racist ideas, and the racist ideas led to and are still leading to the ignorance and hate.
Mm-hmm. It's so powerful, so important. Another really profound finding that you share in Stamped from the Beginning is how you talk about how racial progress is always followed by new and more sophisticated racist progress, right? Like Donald Trump following Barack Obama is an obvious current example. And other people have noted that before, but typically, other analysts or writers talk about how this is a backlash to progress. It's kind of 2 steps forward, 1 step back. But you talk about it in a very different and profound way about, as I understand it, there's like 2 simultaneous tracks with equally progressive movement and growth, one with racial progress and one with deepening racism. And so, again, I think thinking about it in this way can feel like it's insurmountable. What do we do? How do we overcome the persistent deepening of racism and the racist outcomes? How do we make sure that the train on the right track wins?
Mm-hmm. Well, I think we first realize that just because we have won a game, meaning instituted an anti-racist policy, doesn't mean that those who are instituting and pushing for racist policies have stopped playing the game. And what that means is, can you imagine, you walk off the baseball field or the court or the football field thinking that the game is over when the game is still being played. And so I think by recognizing that there actually is a history of racial progress that many of us have been taught and know, but there's a simultaneous history of racist progress. And racist ideas and policies have become more sophisticated over time. And when those who are benefiting from those racist policies, when slaveholders are deprived of their enslaved people, they figure out a new way to ensure Black labor remains cheap, which of course became sharecropping and debt servitude and others. And so, but we have to recognize that in order to fight against it. And I think that's one of the reasons, I think that is one of the problems is if we understand it as this singular history that we're constantly progressing as a nation and we don't recognize that there's a such thing as racist progress, then we're not even going to essentially protect against it. In other words, because anti-racist policies need to be protected. And I don't think people realize that. And I'm hoping people begin to realize that, through the work that's been coming out recently.
Yeah, and the anti-racist policies need to be protected, and the work of being anti-racist is a discipline, right? And it's a constant action that all of us are required to do. And you talk about in your books about how, because all of us are conditioned in a world that is racist and in a country that's really rooted in and structured around anti-Black racism, that all of us can perpetuate these racist ideas, even and maybe especially when we have the best of intentions. And so being anti-racist is really this discipline that requires work. It's constant action. It's constant self-reflection and awareness and, willingness to admit mistakes. And I think this is just such a critically important part of your work for all of us who are on this call, who are working on influencing and making public policy. So just a last broad question for me, and then I'll turn to some of the questions that have come in. But what additional guidance would you give us in doing this work of achieving housing justice, and especially now, during and after this time of COVID-19?
Well, I think first and foremost, especially those who have been fighting for some time for housing justice, it is easy to become hopeless. It is easy to begin to believe that this pandemic of low-income people who do not have affordable housing is essential, will always be. There's too many powerful political and economic forces and even ideological, even ideas that we're fighting against, and so that then cynicism can really sort of grow within. And so what I would say in response to that is that first and foremost, we have to recognize that in order to bring about change, we have to believe in its possibility. And this isn't, this is coming from someone who has studied the history of anti-Black racism, has literally seen the worst and most horrific aspects of this country's history, is regularly seeing that and studying that and observing that and being horrified by that today. But through all of that, I still believe in the possibility of change, not because I have some sort of crystal ball, but because I know I have to believe in change in order to bring it about. I mean, I have to. There's no other alternative. And as hard it is to believe in 1860, when you're one of 4 million enslaved people, that in your lifetime, you're going to see the Jubilee. As hard as it is to believe that when you know your ancestors have been enslaved in this country for about 250 years, it's still possible. And we don't know the possibilities. We don't know what's possible until we bring it out. And so I just want to encourage people, to never stop dreaming and to never stop envisioning a different type of, America, a type of America where you won't even need to be fighting for low-income, affordable housing because there won't be any low-income people. And the idea of affordable housing and the need for affordable housing will be as widespread as the belief that water is wet. That's the type of America we need to create.
Yes, thank you for that, Dr. Kendi. What an incredible, hopeful, inspiring vision. We have had a lot of people send in questions in advance and during and over Twitter. So I want to ask you in our remaining few minutes, I want to ask you a few of the questions that have come in from some of our audience. And one is asking, how do we build the political will for anti-racist policies when so many people and voters in the US are either antagonistic or indifferent, and when policymakers know that voters vote for their own self-interests?
So I think we build that will by showing people that what they consider to be in their self-interest is actually not in their self-interest. In other words, when I encourage people to be anti-racist, even middle-income white people, I'm not encouraging them to be altruistic. I'm encouraging them to do what's in their intelligent self-interest. And so I think it's critical for us to recognize how a more egalitarian America will be better for the vast majority of Americans, except a very, very, very tiny few. The vast majority of us will benefit. Now, it's without question the case that, let's say, white people benefit more from racist policies, obviously, than people of color, but they would benefit too from a more egalitarian America.
Mm-hmm. Yeah, I have a lot of thoughts on that, but I'm not going to share it because we're here to hear your thoughts. But we talk about that a lot in housing too, and even outside of working on towards being anti-racist and centering racial equity, but about how affordable housing, it improves health and improves all of these other aspects. So I think that's really very important and relevant. So another question is, how do widespread racist stereotypes like the welfare queen influence how we advance anti-racist policies?
What happens is racist ideas cause us to view the people as the problem, and thereby causes us to believe racist policies are the solution. And so therefore we don't even imagine the need for anti-racist policies, let alone, push for them. And so racist ideas really cause people to oppose anti-racist policies that actually can lead to equity and justice because they believe inequity is normal.
Another question is from somebody about your book, How to Be an Anti-Racist, who says that in the end, you call for changes in policy to overcome racism, and that the reader thought that where you were going, the change that you were going to call for was the need to overcome white norms, which sometimes go beyond norms as such, and suggest that simply being white is enough or acceptable or forgivable behavior. So can you say more about that?
So I think that one kind of racist idea is what I call is assimilationist ideas. And these ideas normalize white people and suggest that every other racial groups should be striving to become white. And the closer they are to being white, the more and better they are. The other side of that is assimilationist ideas is to standardize what white people consider to be a civilized society. And then the society is created based on white norms and white standards, and everyone else is asked to assimilate in that civilization. So even conceiving, so when we're thinking about an anti-racist society, we should not be thinking about it from the standpoint of what is the standard for white people, particularly in a nation as diverse as the United States. We should be really thinking about a society that really brings in the perspectives and the standards of multiple groups of people. Because if we're not, then we're not building an anti-racist society.
Mm-hmm. And somebody else is asking, actually a couple people are asking about your personal experience with surviving and overcoming cancer and the lessons that you learned from that and apply to the work of being anti-racist that you talked about in some of your books.
Sure. So yeah, how to be an anti-racist. I am talking about my diagnosis. I was diagnosed in January of 2018 with stage 4 colon cancer. And as I went through the process of treatment, I was actually writing How to Be an Anti-Racist. And so I was deep in sort of reflecting on how we can understand racism. And I began to see all these parallels between how we can understand racism through how many Americans understand and even treat cancer. First and foremost, the most obvious parallel for me was I did not want to believe that me in my mid-30s, no risk factors, I'm a vegan, I don't smoke, I don't drink regularly, had cancer. No, that's not me. That's those other people. Just like Americans say, no, I'm not racist, right? I am a Democrat. I'm a liberal. I'm a Northerner. I'm this, I'm that. That's the first sort of obvious connection. But I think there's also the connection of treatment. And so typically metastatic cancer, which is what I had, is typically treated with a systemic and a local treatment. And we can treat metastatic racism, which our communities in this nation is suffering from, with the same systemic and local treatment. The local treatment in which a physician would go in and surgically remove the tumors of racial inequity, to get rid of them, right? To get rid of those racist policies that are behind those tumors. But then we wouldn't stop there. We would actually flood the body with anti-racist policies that reduce those inequities, reduce those cells, those tumor cells of inequity that we can't even see, and that can prevent a reoccurrence. And so I think the way we understand cancer or treat cancer should be the way we can understand and treat racism. But going back to the denial, people tell me all the time, you should not identify what she said or what she's doing or her as racist because it's going to hurt her. There are Americans every day right now who are being diagnosed with COVID-19. No one is saying, well, let's not tell them they have COVID-19 or they have cancer or they have hypertension because it's going to hurt them. No, actually, diagnosing a person is going to help them. That's the first step in them receiving treatment, even though that treatment is going to be very hard. And I think if we had the same mentality about racism, and we also did not imagine that each of us were experts, that we can just diagnose ourselves with COVID, or we can diagnose ourselves as not having hypertension, that we actually relied on people with expertise, I think we'd be that much better off.
So I wish we could continue this conversation. I have more questions, and we have more questions that have come in, but we are out of time, and I want to respect your time, Dr. Kendi. I know you have another appointment right after this, so we do need to close this call now. But what an amazing conversation, and I just want to tell you, Dr. Kendi, how grateful I am, how appreciative I am for your work, and for your taking the time to share these really powerful and important insights with all of us. So thank you so much for this conversation, and thank you so much for joining us here today.
Oh, you're welcome, Diane. And yeah, I'm just really excited to have had the opportunity to converse with you. I'm a huge fan of your work and the work of specifically your organization. And, this is an issue, obviously, that I really hold dear. Housing justice. There are numbers of forms of justice that we need in this country, and certainly housing justice is at the top of the list.
Yeah, absolutely. So thank you so much again. And thank you to all of you who joined today. I think nearly 5,000 people on today's call. I really appreciate all of your interest. And I really encourage and urge you all to continue this conversation in your communities. I hope you'll read all of Dr. Kendi's books and articles, and I hope each of us will commit ourselves to the work of anti-racism. And I also hope that all of people who join this call today will join us at the National Low Income Housing Coalition in our work to achieve an equitable response and recovery to this and all disasters, and in our work to end homelessness and housing poverty once and for all. So please visit our website, which is www.NLIHC.org. And you can get information on membership. You can sign up for our newsletters, get calls to action, and become involved in our work on COVID-19, housing and homelessness, and beyond. So thank you all so much for joining us. Thanks again, Dr. Kendi. Thank you all for your good work in your communities around your country. Take care around our country. Take care, stay healthy, and bye for now.
Bye-bye.
Bye.